Hello, I'm April Wilkerson. This is my presentation on aneurysm for PTA 250. An aneurysm is a localized abnormal dilation of a blood vessel. Usually occurs in an artery. It's basically like a weakening in the wall where it balloons out into the tissue. I'm going to talk about the two most common kinds of aneurysms today. Those are the abdominal aortic aneurysm and a brain aneurysm. 1 in 5 abdominal aortic aneurysms that rupture have a chance of survival. The risk there is with internal bleeding. And with the brain aneurysm that ruptures, which you may hear it as a hemorrhagic stroke or a CVA, that's basically a stroke, so the brain damage could be mild, moderate to severe, or you could have none at all. Symptoms and diagnosis. An early diagnosis can prevent a rupture, and a rupture can be fatal, so you would like to have that diagnosed early. The problem is most aneurysms are asymptomatic until they rupture. A patient may experience a sudden unrelenting pain in the side and the back, or they may have a non-tender pulsation over the midline of the abdomen. If that is the case, they should have an abdominal ultrasound. That's how you would diagnose an abdominal aortic aneurysm. If it's found before it ruptures, and it's less than 6 centimeters in diameter, the doctor is going to ask them to stop smoking. They may put them on blood pressure medication and possibly start monitoring their blood glucose levels and encourage them to start engaging in regular physical activity. If it is more than 6 centimeters in diameter, they're probably going to do surgery, endovascular surgery, where they place a graft, a flexible graft inside the arterial wall, and it just reinforces that weak spot in the wall so that the blood won't bulge out into that aneurysm, put any more pressure and rupture. And then a cerebral angiography can be diagnosed, or a cerebral angiography is how you would diagnose a brain aneurysm. And it can be endovascularly addressed as well. Instead of a graft, is a coil that they put in the aneurysm, and that stops any more blood from flowing into that dilation. Our physical therapy applications, I'm just going to talk about what they would be post-stroke, because that would probably, at least as far as our research, that's our most commonly how it would apply to us. And it depends on the severity of the brain damage from the stroke, where we would start with our modalities, how much loss of motor function there is, the level of pain, the patient's strength. The goal of our modalities being to return to the activities of daily living and have our patient be as independent as possible. So some of the things we might see are neuromuscular electrical stimulation. We'll probably start with some sitting balance. You'll have sit to stand training, balance training during weight-bearing activities, so a gait training. There might be assistive devices, if necessary, teaching your patient how to use a walker, how to walk with a cane, maybe how to use a wheelchair if necessary. And then we'll probably be educating a patient's family members, maybe with transfers, but maybe with wheelchairs. And that's pretty much everything for aneurysm, so thanks for watching.